Doc Plexus, in collaboration with TaskMed, brings to you MEDCAST, providing insights into healthcare, a KOL interaction series. We have with us Dr. Banshi Saboo, a chief diabetologist and chairman of Diabetes Care and Hormone Clinic at Ahmedabad. He is currently the joint secretary of RSSDI and president of RSSDI Gujarat chapter and has organized many national and regional conferences. Dr. Saboo, it's a pleasure having you here today.
Thank you.
So today's topic of discussion is diabetic dermopathy and its complications. Shall we start, Dr. Saboo?
Yes.
Great. So the first question, Dr. Saboo, what is the relation between internal complications and diabetic dermopathy?
So first of all, thanks Doc Plexus for inviting me on this digital platform. Kritika and TaskMed, thanks to both of you. What you know that diabetic dermopathy is one of the complications of diabetes which is very much underreported and less recognized by primary care physician. This is the condition. It is because of dry skin. Unless the patient complains of it or unless the patient says that there is a lot of itching and he is feeling the dry skin, most of the time doctors either they don't take the attention of it or they don't refer the patient to the skin specialist. Mostly these patients blindly, they go to the dermatologist and they try to find out it is a dry skin. But in diabetic patients, this dry skin or a dermatopathy is a very common problem of diabetic patients.
Rightly said, Dr. Saboo. But I would like to know more about, let's say, how is diabetic dermopathy related to the internal complications associated with it?
So this is one of the complications. If a person is having a diabetic dermopathy, it means there is some complication is already been started. It means a long-standing diabetic patient having a neuropathy. He is having a autonomic neuropathy. There is always a possibility if a one microvascular complication is there in the body, there are other microvascular complications which are also there. If patient is having microvascular complication, there is always a possibility of macrovascular complication also. So like this becomes a window. This becomes a diagnostic, the patient who come with a complaint of dry skin or who had been diagnosed with dermopathy, it becomes an opportunity for a diabetologist or a doctor to investigate her or him for other complication of diabetes.
Great to know that, Dr. Saboo. So moving ahead, which factors affect the development of internal complications?
So one is a uncontrolled diabetes itself is the biggest reason for all the complication. It is the long-standing duration of diabetes, even age of the patient. These are some of the other factors. But other modifiable risk factor, which I will say, one is the cigarette smoking, which leads to more of a peripheral vascular disease. In the person with a vascular supply which is getting hampered in the periphery, they get more dermopathy also because they have underlying angiopathy too. So I mean, these are some of the other factors other than that. And then there are some patients who had a recurrent foot infection, which may be also one of the important reasons for them to have a dermopathy. So these all risk factors also to be modified in a patient who is prone to develop diabetic dermopathy or who have already diabetic with dermatological complication.
So Dr. Saboo, let's say in diabetic dermopathy, how is skin blood flow affected?
So that is what microangiopathy. It is actually microvascular supply of the skin and subcutaneous tissue in a diabetic patient. As we know that diabetes itself is an angiopathy. It's a vascular complication of a high sugar, and that affects everywhere, whether you talk of retina, whether you talk of a heart failure because of diabetes, whether you talk of a nephropathy or a kidney issue. Then in similar way, these microvascular supply of a skin and subcutaneous tissue is getting affected, and that leads to this microangiopathy is one of the important reasons for them to have a dry skin or a dermopathy.
When we talk about the blood flow and the internal complications, is it right to say that, more than 2/3 of the patients will also develop these internal complications like neuropathy or other related that you've already mentioned?
If I have a patient who have a microangiopathy, who have already a patient with a dermopathy, it is almost like that more than 2/3 of them will have some or other complication. There is no doubt about it. And we would like to investigate these patients for other microvascular complications. you talk of nephropathy, retinopathy, all these complications are to be screened in these patients.
Great to know that, Dr. Saboo. Moving ahead, what is the clinical evidence for association of altered skin blood flow and diabetic dermopathy?
So one is the clinical evidence is the first and foremost thing one should examine the food. So the coloration, the discoloration of food itself is also will give you the idea about that there is a vascular supply whether getting hampered or not. Then the hair growth in male patients, it will be more seen because females are regularly getting removed off. But on male patients also you can see that there is a decrease in hair growth also. Then the dry skin will also show you on examination also you can see. While touching, you can see it can be, there is a possibility of cold skin in compared to the flow where it is increased, then you are going to have a warmer skin also. So I mean, the temperature by touching itself will also give you the idea about the how the angiopathy, whether it is leading to more flow or whether it is causing a decreased flow also in the skin level. So the temperature itself will also give the idea. The third thing is the dryness. By touching it also you can feel that there is a roughness on the skin, which will also give you an idea that now the patient had developed significant dermopathy. And then on scratches, mark, and which the patient will going to have it because it's a dry skin. So that is also on examination. These are the clinical evidence which you can see while examining the patients when patient had come to your clinic.
That was quite insightful, Dr. Saboo. Now that we've already talked about microangiopathic complications, I would request you to elaborate a little more about it, like what microangiopathic complications are observed in diabetic dermopathy patients.
So one is microangiopathic complication. One of them is very important is retinopathy. So we should screen these patients for a retinal examination because that's also an important microvascular complication. The second important thing which we should screen for these patients for nephropathy. So the urine for microalbumin, urine albumin creatinine ratio, and basic creatinine value, these three things are to be done with these patients. But at the same time, the LV function, the echocardiography, clinical examination, macrovascular as well as microvascular complication, it's a part of angiopathy that also we should get. And primarily we should get the echocardiography to know the LV function of these patients. So these three are important. But many times we forget that these are the patients who have microangiopathy. So the peripheral nerves are to be examined, not only for neuropathy, but for cardiac autonomic neuropathy also. Because autonomic neuropathy patients who have, they have dermopathy more, and they also have simultaneously autonomic nervous system get affected of a heart tissue also. So we must examine the cardiac autonomic neuropathy. Now, what are the investigation which we can do? One very simple is a postural hypotension. So at different posture, you have to take the blood pressure. Second is resting plus pulse rate. The third is on Valsalva maneuver, you have to see whether there is a vagal stimulation is decreasing the pulse rate or not. So these are the three basic investigation one can do, and a baseline electrocardiography ECG. These are the investigation are to be done in a patient where you are suspecting or you have a patient with a angiopathy, diabetes, angiopathy along with dermopathy. These other investigation we must do to rule out other complication of diabetes.
Thank you for that elaborative answer, Dr. Saboo. So we've covered up almost everything about the microangiopathic complications, but can you also specify the causes behind these complications?
So one is the uncontrolled sugar and long standing of diabetes. So, patients who are coming to us, they normally comes later once they develop complications. I mean, maybe after 8, 10, 12 years, because first 5 to 7 years, many of these patients, they don't have any complication or they don't have any complaint also. So these are the times when they are not keeping their sugar very good glycemic control or an intensive glycemic control. Rather, we always teach that early and aggressive glycemic control reduces the micro and macrovascular complication throughout the lifetime. It's just not only for a few months or few years. Rather, if somebody is having an intensive control in his early course of diabetes, he is going to have this memory, this legacy effect will be there throughout the lifetime. So one of the important reasons for them to have a complication is a not early and aggressive control which they could have. number one. Second, once they have a complication, then they try to do a good control or a tight glycemic control. At that point of time, it is not going to give any benefit. The third thing, smoking or tobacco chewers. In India, more tobacco chewers are also very high number of patients, and that is also one of the important risk factors for them to develop different type of complication. Third is the sedentary lifestyle. The most of the time sitting all the time, not walking, not doing any physical activity. That itself, it also decreases, it hampers the circulation of the blood, which is also increases the risk for all type of angiopathy, all type of vascular complication in a diabetic patients.
Great, Dr. Saboo. So we've already covered a part of the prevention when it comes to diabetic dermopathy and its complications. Can you also please highlight the importance of topical care?
So the topical care is required for two reasons. One is that moisture had gone away. So you know that once moisture had gone away, there is a lot of scratching or a lot of symptoms. So by giving them a local or topical application or a moisturizer will help that they will continue to remain moist, the skin will remain moist, so there will be less scratching, less symptoms of the all the time patient is complaining of that I have a feeling of that I have to scratch. So that feeling will go away, that symptom will go away. That's number one. The second importance is that dry skin will lead to more complication as far as infection is concerned, because dry skin in a foot will lead to more of a fungal infection, interdigital space infection also, which is common, and that trivial infection can lead to diabetic foot. So I mean the local application of moisturizer or a local application which helps in patients of a diabetic dermopathy or dry skin, actually preventing these patients to have a diabetic foot problem. So I think early diagnosis of angiopathy, early diagnosis of dermopathy, early diagnosis of dry skin, actually preventing them for a diabetic foot problem, because then you will able to treat them.
So is it right to say that skin hydration is also somewhere very important?
Very, very important, because otherwise they will lead to more infection.
Right. So thank you so much, Dr. Saboo. It was quite an insightful discussion for us and for our viewers. I'm sure our community will be benefited from it a lot. Thank you so much for your time.